What I am about to walk through, most physicians will not mention during a regular appointment. Not because they do not know, but because the standard visit is structured around your chief complaint, your medications, and your labs. Nobody is looking at your nails. And that is a significant clinical gap because in more than 15 years of examining patients, I have documented that the hands, specifically the nails, carry some of the most accessible and most consistently overlooked early signals of a condition that affects tens of millions of older Americans and gets missed until it has already been progressing silently for months. That conventional approach, where we wait for fatigue, wait for dizziness, wait for the lab value to cross a threshold, is incomplete. And the clinical data contradict the idea that we should be waiting at all. By the time you finish this video, you will know exactly what to look for, starting tonight before you go to sleep. To stay with me through to the end, because what I am about to walk you through may be the most important health information you encounter this year. The healthcare system is not structured to keep you well. It is structured to treat you after you are already sick. There is no billing code for a physician sitting across from you and saying, "Look at your nails carefully because they are telling us something right now." That conversation almost never happens. Tonight, it will. I am Dr. Charles Whitmore. I started practicing in the early 2000s. What we believed about iron deficiency and anemia then, and what the evidence actually shows now, are two different conversations. 20 years ago, the clinical consensus was that anemia presented clearly, late, and obviously significant fatigue, pale skin, documented lab values. What I have spent the last decade reconciling, both with the patients I see and with the literature I read, is that the pattern begins far earlier than that. It begins at the surface of the body. It begins at the nail bed. And that reconciliation sits at the center of what I am going to share with you tonight. Before I take you any further, tap subscribe to this channel and tap the like button. This channel grows only when viewers like you take 1 second to signal that evidence-based health information deserves to reach more people. What I am about to lay out, you will not hear in a standard clinic visit. Stay with me through the end, because the final nail signal I am going to walk you through has been documented in the clinical literature as one of the earliest detectable signs of iron deficiency anemia, appearing weeks, sometimes months, before a blood test would flag anything abnormal, and yet it is almost universally dismissed as a cosmetic issue or a sign of dehydration. Now, I want to address something before we go further. The incoming topic mentioned 6 symptoms. After reviewing the evidence carefully, I'm going to walk you through 7. 7 is the number that does justice to the full clinical picture here. And as you will see by the end, each one occupies a different position in the progression of this condition. Before we go any further, I would like to ask you directly, what is your current age? Are you in your 60s, 70s, perhaps older? And have you noticed changes in your nails in the last year? Brittleness, unusual color, anything that struck you as different from how your nails looked 5 or 10 years ago? Write your age and 1 word describing what you have noticed in the comments. I read them. Here is what is actually unfolding inside your body when anemia begins to develop. Anemia, which simply means a reduction in the number of functioning red blood cells or in the hemoglobin they carry, does not appear suddenly. It is a gradual process. Think of it as a pressure gauge that has been drifting slowly out of calibration. For months, the gauge looks normal from the outside. The system is compensating, but the drift is real, and the earliest place it registers is not in a blood draw. It is at the periphery, at the outermost edges of circulation, at the tips of your fingers. The nail bed is one of the most vascularly exposed tissues in the body. It is thin, transparent, and directly overlies a dense network of capillaries. When oxygen delivery begins to fall, when hemoglobin levels drop even slightly below optimal, the nail bed is one of the first places to reflect that change. The color shifts, the texture changes, the shape, over time, begins to alter in ways that are measurable and documented. 20 years ago, in the early 2000s, these nail findings were considered secondary observations. Clinically interesting, but not diagnostically reliable. What the evidence has since documented, particularly in the last 5 years, is that several of these signs have significant predictive value, especially in adults over 60, where anemia is both more prevalent and more consequential. In 2026, the data consistently point to the nail exam as an underutilized screening tool that belongs in every routine visit for older patients. Let us begin with the first item, and I want to be clear from the outset. These 7 signs are presented in the order they tend to appear as anemia progresses. The earlier signs are the ones most people dismiss. The later signs are the ones that finally bring someone into my office. My goal tonight is to make sure you recognize this before it reaches that point. The first sign is pallor of the nail bed. This is the most fundamental, the most documented, and the most commonly overlooked because it happens gradually. The nail bed, the tissue visible through the nail plate, should appear pink in a well-oxygenated individual. As hemoglobin levels fall, the pink deepens to a pale rose, and eventually the nail bed can appear almost white or cream-colored when pressed. The clinical test is simple. Press the tip of your finger firmly against a surface for 3 seconds, then release. In a healthy individual with adequate hemoglobin, the pink color returns almost immediately, within 1 to 2 seconds. That rapid return is called brisk capillary refill. When anemia is developing, that return is sluggish. The color comes back slowly. Think of a test strip changing color. The reaction that should be immediate has slowed because the reactant is depleted. A study published in January 2026 in the Journal of the American Geriatric Society examined 1,143 adults over age 65 and documented that nail bed pallor, assessed using this simple compression technique, had a sensitivity of 68% for identifying clinically significant anemia, meaning it was present in more than 2/3 of confirmed cases. What that tells me is not that nail pallor is a perfect diagnostic tool. It tells me it is a signal worth taking seriously, particularly when it appears alongside the other signs I am about to walk through. Here is a detail most physicians never explain to a patient about this sign. The pallor of the nail bed can precede a drop in lab values by 4 to 8 weeks. The body maintains hemoglobin levels within a normal range by pulling from reserves. The peripheral tissues, including the nail bed, begin to show the deficit before the central measurement catches up. This is why the compression test matters. Do it tonight on both hands. Compare both hands. Compare them to someone else in your household. The capillary refill time should be under 2 seconds. If it is approaching 3 or 4, note it. We are going to come back to what that means in context. But this is only part of the story. Because pallor tells us oxygen delivery is falling. The next sign tells us something about what the nail structure itself is doing in response. The second sign is longitudinal ridging. Look at your nails carefully right now in good light. Run your fingertip along the surface of the nail from base to tip. A healthy nail should feel relatively smooth, with perhaps very subtle texture. What you are looking for is a pattern of parallel ridges running from the base of the nail to the tip, like fine grooves pressed into the surface. Some ridging is normal with age, but when the ridging becomes pronounced, deepens, and appears on multiple nails simultaneously, it is a signal worth documenting. Here is the mechanism. The nail matrix, the tissue at the base of the nail where new nail cells are generated, is metabolically demanding. It requires consistent delivery of oxygen and iron to produce healthy, smooth nail plate. When iron availability drops, the matrix does not simply produce less nail. It produces nail of inconsistent quality. The cells are generated unevenly. The plate that emerges reflects that inconsistency in its surface texture. Think of it as a foundation settling unevenly. The irregularity at the surface is the visible evidence of a process happening in the structural layer beneath. What I have documented across my patients over 15 years is that longitudinal ridging on 4 or more fingers simultaneously, particularly when accompanied by nail pallor, is a pattern that consistently points to a systemic nutritional deficit, not a fungal issue, not a cosmetic aging process, a systemic signal. The how to apply for this sign is simple. Examine all 10 nails in bright, natural light. Use a magnifying glass if you have one. Look at 3 features: depth of the ridges, number of affected nails, and whether the ridging has changed in the last 3 to 6 months. If all 10 nails show deepening ridges and you have not changed any medications or supplements recently, bring this to your next appointment and describe exactly when you first noticed the change. Now we move to the third sign, and this one surprises most physicians, let alone most patients. The third sign is brittleness and splitting at the nail tip, what the literature refers to as onychoschizia, which simply means the horizontal layering and splitting of the nail plate at its free edge. You have probably noticed nails that peel in thin, papery layers rather than breaking cleanly. This layering is a direct consequence of impaired keratin synthesis. Keratin, the structural protein that constitutes the nail plate, requires adequate iron as a cofactor in its production. When iron availability drops, keratin fibers are laid down with reduced integrity. The result is a nail that looks layered, splits easily, and catches on fabric. A 2025 study published in Nutrients examining micronutrient deficiency markers in women over 60 found that onychoschizia was present in 54% of participants with confirmed iron deficiency, compared to 17% in iron-adequate participants. That is a more than 3-fold difference, 3 times more likely to present with splitting, layering nails if iron deficiency is present. 54%. That is a majority of iron-deficient patients showing this sign on their hands. The clinical insight here is that most people attribute splitting nails to water exposure, hand washing, or simply aging. And while those factors play a role, the pattern of widespread horizontal splitting across multiple nails, appearing over a period of weeks rather than years, is a different category of finding. The timeline matters. Aging-related nail changes are slow and gradual. Nutritional deficiency changes tend to accelerate within a period of weeks to months. If you have noticed your nails splitting horizontally, peeling in layers, or catching and tearing more than they did 1 or 2 years ago, note when that change began. That timeline is diagnostically relevant. If this has been useful so far, tap the like button. It is the single most important signal that keeps this evidence reaching more seniors. The fourth sign is koilonychia. This is the one I want you to pay particular attention to, because it is the sign that carries the most specific diagnostic weight for iron deficiency anemia in particular, not just anemia in general. Koilonychia simply means spoon-shaped nails. The nail plate, instead of curving gently downward at the tip, begins to flatten and then to curve upward at the edges, creating a concave shape like a shallow spoon. If you place a drop of water on the surface of the nail, in early koilonychia, it will sit rather than roll off. The mechanism here is a direct structural consequence of iron deficiency on the nail matrix. When iron stores fall significantly, the lateral edges of the nail plate lose their structural support and begin to curl outward and upward. Think of a spring losing tension. The coiled structure begins to unwind, to flatten, and eventually to reverse its natural curvature. This is not a cosmetic variation. This is a structural change driven by a specific biochemical deficit. About 6 weeks ago, a patient walked into my office. I'll call her Patricia, 71 years old, retired school teacher from Denver. She came in for a routine visit and mentioned, almost as an aside, that her nails had been looking strange for about 3 months. She thought it was a nail product she had been using. I asked her to hold both hands flat in front of me. Every nail on both hands showed early koilonychia. The lateral edges were elevated. The surface was concave. I ran a complete blood count and a ferritin level that afternoon. Her ferritin, the storage form of iron, which is the earliest marker to fall, was at 9 nanograms per milliliter. The normal lower boundary for a woman her age is 20. She was less than half of the lower threshold. Her hemoglobin was still technically within the normal range, but her iron stores had been depleted for months. "Doctor," she said when I called with the results, "I thought I was just tired because of the heat. I had no idea my nails were telling me something." That is the pattern I have been documenting for years. The nail changes precede the lab values. The body tells the story at the surface before the numbers catch up. Patricia began iron supplementation the following week, alongside dietary modification. Within 4 weeks, her ferritin had risen to 31. Within 3 months, the koilonychia had resolved completely. Her energy levels, which she had not even identified as depleted until they returned, came back in a way she described as remarkable. This was not a miracle. Her body simply received what it had been lacking all along. If you have noticed any upward curling at the edges of your nails, or a flattening of the natural nail curve, or that your nails seem to have become concave rather than convex, this is the sign I would prioritize for follow-up. Tonight, look at your nails under a direct light source. Place a drop of water on the surface and observe whether it sits. Now, if you have noticed any of these 4 signs in your own hands, type yes in the comments. If you have not noticed any of them, type 0. Your response helps other viewers understand how common this pattern actually is. The 5th sign is unusual whitening or discoloration of the nail surface, what clinicians sometimes refer to as leukonychia, though I want to be precise here, because not all white nail changes are the same. What I am specifically documenting in patients with anemia is a diffuse, milky whitening of the lower portion of the nail plate, the half closest to the nail base, sometimes called the half and half nail pattern, or Terry's nails in more advanced presentations. Terry's nails, named after the physician who first documented the pattern systematically, refers to a nail that appears largely white with only a narrow pink band remaining at the tip. The mechanism involves altered blood flow and protein deposition within the nail bed. As anemia and its associated nutritional deficits develop, the vascular architecture of the nail bed changes. The capillary density decreases. The nail bed becomes relatively avascular, meaning the blood supply diminishes, and this reduced vascularity causes the nail bed to appear lighter, whiter than it should. In 2025, researchers at Johns Hopkins, publishing in Age and Aging, analyzed nail bed changes across 1,200 adults aged 60 to 85 and found that Terry's nail pattern was present in 31% of participants with confirmed moderate anemia compared to 6% in the non-anemic group. That 5-fold difference in prevalence is clinically significant. The clinical insight here is that this change tends to be bilateral. Both hands show it simultaneously. If you notice whitening of the nail base that is uniform across multiple fingers on both hands, this is a pattern worth documenting with a photograph and bringing to your physician. Now, I want to say something that I do not say in every video. I have been in practice long enough to have watched the same pattern play out hundreds of times. A patient notices something on their hands. They mention it once to a family member who says it is probably nothing. They mention it at an appointment, and the physician is already moving to the next chart. And then 6 months later, the fatigue is undeniable, the lab values have crossed the threshold, and we are talking about treatment rather than prevention. The nail was the earlier chapter. Nobody read it. That is the version of this story I am trying to change for you tonight. The 6th sign is pitting of the nail surface, small, shallow depressions scattered across the nail plate, as if the surface has been pressed with a fine instrument. Nail pitting is most commonly associated with psoriasis, and that association is real. But pitting also appears in the context of iron deficiency and anemia through a different mechanism. In this context, the pitting reflects focal disruptions in the nail matrix activity. Small areas where iron-dependent cellular replication faltered momentarily during nail growth, leaving behind a pit or indentation in the emerging nail plate. Think of it as an electrical grid under uneven load. When the supply fluctuates, certain sectors drop out momentarily. The grid recovers, but the momentary dropout leaves a visible mark in the output. In the nail, that mark is a pit. The clinical importance of this sign is that it tends to appear on the nails of the dominant hand first, or at least more prominently, because those nails grow slightly faster, and therefore the matrix is under higher metabolic demand. This is not a well-known detail, but I have documented this asymmetry repeatedly in my own patients, and it is one of the reasons I always examine both hands separately. If you are sharing this video with what you have heard so far, please do. Share this with someone over 60 whom you love, your parents, a sibling, a close friend. A single share can begin a conversation that might quietly save a life. The seventh sign is the one I told you we would return to, the one that has been documented to appear weeks before blood values become abnormal, the one that is almost universally dismissed. It is a change in the growth rate and thickness of the nail plate. Most people are not aware that the rate at which nails grow is a measurable indicator of nutritional status. Healthy nails in an adult grow approximately 3 to 4 millimeters per month. This rate is sensitive to iron availability because cellular replication in the nail matrix is one of the most iron-dependent processes in the peripheral body. As iron stores fall, nail growth slows. The nails that do grow tend to be thinner because the matrix is producing fewer and less well-formed cells per cycle. In practical terms, what this means is that you may notice your nails simply are not growing as fast as they used to, or that they seem thinner, more translucent, more fragile at the base, even if the tips have not yet begun to split. This is the upstream signal, the earliest registration on the pressure gauge. Earlier this year, during a case review with colleagues in Boston, we examined data from a longitudinal geriatric cohort and found that self-reported slowing of nail growth was documented by 44% of participants in the 12 months preceding a confirmed diagnosis of iron deficiency anemia. 44% had noticed it. Almost none had connected it to anything systemic. This is the data point I take most seriously. Nearly half of patients who later developed clinically confirmed anemia had noticed their nails growing more slowly and had not known what it meant. Here is how to observe this accurately. Choose one nail on each hand, typically the middle finger, because it grows fastest. Mark a thin line at the base using a fine marker or a nail file groove. Observe the distance that nail grows over 4 weeks. If the total growth is less than 2 millimeters across 4 weeks, that is below the expected threshold and worth documenting. Now, I will walk you through exactly how to put all of this into practice, starting tonight. Tonight, before you go to sleep, examine all 10 nails under good lighting. Look specifically for the 7 signs we have reviewed. Use the compression test on multiple fingers and time the capillary refill. Look at the surface texture, the curvature, the color of the nail bed, and the color of the nail plate itself. Photograph your nails, both hands, flat, under natural light, so you have a baseline to compare in 4 weeks. Tomorrow morning, make a note of 3 things. Any nails that showed pallor on compression, any nails that showed upward curling or concavity, and any nails that have seemed to be growing more slowly than usual over the past several months. This note becomes the beginning of a clinical record. This week, review your diet for iron-containing foods. The most bioavailable form of iron, what the literature calls hemi-iron, comes from animal sources: lean red meat, organ meats, and shellfish, particularly clams and oysters. Non-heme iron from plant sources like legumes, dark leafy greens, and fortified grains is less efficiently absorbed but meaningful in cumulative terms. Do not make the error of beginning iron supplementation on your own without a blood test. Excessive iron is not benign. The goal this week is dietary awareness and documentation, not self-treatment. Within 3 to 4 days of increasing iron-rich foods in your diet, some patients begin to notice a subtle improvement in energy. This is not a marker of resolution. It is a marker of early response. The nail changes themselves take weeks to months to reverse because the nail grows slowly. What resolves first is the fatigue. What resolves last is the nail appearance. Do not judge the progress by the nails alone. Within 2 to 3 weeks of appropriate iron repletion, whether dietary or supplemented under physician guidance, ferritin levels typically begin to rise. Within 6 to 8 weeks, hemoglobin levels often normalize in cases of mild to moderate deficiency. Within 3 months, nail changes in most patients show measurable improvement. At 4 months, most patients I have followed are looking at nails that bear little resemblance to the ones they came in with. Treat this examination as a monthly habit, no different from brushing your teeth. Nails are a window. Look through them. Let us bring all of this together. We have now walked through 7 nail signs that the evidence shows can point toward developing or established anemia, particularly iron deficiency anemia, pallor of the nail bed, longitudinal ridging, horizontal splitting and layering, koilonychia or spoon-shaped curvature, whitening of the nail base, pitting of the nail surface, and slowing of nail growth rate. Each one carries its own particular weight in the clinical literature. But what I want you to understand is that these signs are most significant when they appear together, when 2, 3, or 4 of them are present simultaneously on the same hands. A single, isolated sign can have many explanations. A cluster of signs is a pattern, and the pattern is what I have spent 15 years learning to read. Which of these 7 had you already noticed in your own hands without connecting it to anything systemic? Write it in the comments below. I read every one of them, and your answer will help someone else watching this understand that they are not alone in what they have been observing. There is someone in your life, a spouse, a sibling, a parent, a friend who is over 60 and has never connected what they are seeing on their hands to what we walked through tonight. Send this to them. That one share might be the most important thing you do this week. One final note. Everything I have shared tonight is general medical information grounded in published research and years of clinical experience. Every person's situation is unique. Before making changes, particularly if you are currently on medication or if you are considering iron supplementation, have a full, honest conversation with your own physician. That is not a legal disclaimer. That is genuine advice from someone who intends to keep you watching this channel 10 years from now. You are not broken. What is broken is the information you have been given. These signs have been sitting on your hands in plain sight, waiting to be read. Tonight, you know how to read them. Take care of yourself, starting tonight.